Now that we know how hormones affect our bodies, let's move on to something equally as important, which is chronic inflammation.
Inflammation is part of our immune system, and it is a response to injuries, sickness, and even stress. When our body is injured, white blood cells release chemicals into the blood and tissues that are affected. However, did you know that excess eating also triggers our immune system to release these same chemicals? This leads to excess inflammation throughout our bodies.
This is why we can sometimes feel really bloated after a huge meal. Although inflammation is a natural reaction from our bodies, it is important to talk about chronic inflammation, which is a significant risk factor for cancer and other diseases.
That's right. In the case of obesity, adipose tissue or fat cells in your abdominal area causes chronic inflammation that is not in response to a specific injury or sickness. This chronic inflammation can lead to elevated tumor necrosis factor, or TNF-alpha, which can cause damage to our DNA, leading to cancer. TNF-alpha is a type of inflammatory cell that triggers the immune system, leading to inflammation. TNF-alpha is also believed to be involved in the development and progression of cancer. Inflammation releases reactive oxygen and nitrogen species, which are both able to cause damage to your DNA.
Did you know that 3 of 5 people die worldwide due to diseases related to inflammation? Stroke, chronic respiratory diseases, heart disorders, cancer, obesity, and diabetes. These diseases are actually expected to rise in the US and around the world. So how exactly is inflammation yet another factor leading to cancer?
Well, you're asking great questions, Jay. The truth is that inflammation is responsible for several chronic conditions such as colitis, pancreatitis, and hepatitis, and it also decreases the ability of the immune system to attack pre-cancer cells and increase the resistance to cell death, which leads to tumor growth and cancer progression.
So here are some signs to determine if you suffer from chronic inflammation: insulin resistance, muscle weakness, diarrhea, back pain, tiredness, rash, arteriosclerosis, blood clots, dry eyes, or memory issues. Each of these symptoms are related to a specific inflammatory condition.
If you have any of these symptoms, you may want to discuss it over with your doctor. However, we can all make changes in our lives to help this chronic inflammation.
Some simple ways would be to eat more fruits and vegetables, especially your leafy greens, as well as limiting our sugar intake.
Physical activity is also a big prevention method in order to lose the weight and manage stress levels in our body.
We invite you to stick around as we discuss the topic of excess insulin and how this too may lead to the development of cancer.